I'm going to discuss two questions today. Both I have taken from USMLE. Okay, let's start. A 45-year-old woman presents to the doctor with feelings of fatigue, increased appetite, increased sweating, palpitations. Her doctor also noted that her eyes appear unusual. She received pharmacologic treatment for her condition, but soon develops a fever and multiple infections in the throat, gastrointestinal tract. Her doctor quickly discontinued the medication. What medication was she most likely prescribed? Okay, so if you know that it is something related to that of the endocrine system, and the sign and symptoms given here that increase fatigue mean there is excess utilization of the energy by the body cells. So the patient easily tired, increased appetite because of increased basal metabolic rate, increased sweating, and palpitations. These are, you can say, the symptomatic of activation. This and the eyes that appears unusual in this condition. So if you don't know the sign and symptoms, if you just know that the picture given here is something like the lids are retracted upward and the eyes are bulging outside, this means something going behind the eye. There is a retroorbital fibrosis that pulls or the push the eye outward. So it is nothing but exophthalmos. And typically the exophthalmos is related to hyperthyroidism. Okay, now you have got the diagnosis. Okay, so what they're not asking the diagnosis directly. They are asking that this patient has given certain medication for this condition, and after taking that medication she starts some infection in the throat and gastrointestinal tract. So what is the side effect of what medication has certain side effects? Okay, so once you know that this is the hyperparathyroidism, where the excessive protection of the hyperthyroidism, where the excessive protection of the thyroid gland, that causes the symptoms given here and the sign of such eye or exophthalmos. Now we see that, does folic acid cause such symptoms? No. What about levothyroxine? The levothyroxine is a thyromimetic drug. It is given when the patient suffers from hypothyroidism, not hyperthyroidism. What about propranolol? Propranolol is we can say it's a beta blocker. It can also use as a prophylaxis or in various conditions. So it can also use in case of hyperthyroidism in order to maintain the heart rate in case of thyrotoxicosis. And it also help by inhibiting the peripheral utilization or the conversion of thyroid T3 to T4 to T3. Okay. What about, but it doesn't have any side effect like infections or some gastrointestinal abnormalities. It usually causes bradycardia. It cause in case of if the patient is diabetic, it can mask the symptoms of the diabetes, hyperglycemia. In case of asthmatic patient, it can worsen the asthma, but it doesn't show like symptoms like infection and certain throat infection or gastrointestinal tract infections. So what about the radioactive iodine? Radioactive iodine is used as diagnosis purposes as well as for the treatment, but not in the initial stages. And it doesn't have symptoms like infection or like that. So by ruling out all, we can say that our answer is propylthiouracil. If you want to know that how, then the one of the side effect of propylthiouracil is a granulocytosis. Okay, so what does it mean, agranulocytosis? We know granulocytes, that neutrophils, they are the granulocytes, basophils, eosinophils, so they're all the white cells that fight against infection, allergic infections, and they have granules inside. So it causes agranulocytes, mean there is absent of all these cells or decrease the level. So once the WBC decreases, the body fails to defend against certain infections. So what happened? The patient more prone to throat infection and other infections. So this condition is the same. It is a side effect of the propylthiouracil, where the patient has agranulocytosis that results to multiple infections in the throat and gastrointestinal tract. Okay, we have done this one. Let's move to the other question. This one is quite difficult question, is I think. The overactivity of smaller pale cells with round nuclei shown in the image can lead to fibrous tissue with hemorrhagic foci and cyst formation in bone marrow. What are these cells called? You cannot, pick up if you don't know the histology. You cannot pick up if you don't know the relationship between the thyroid hormone, parathyroid hormone, or other hormones and their action on the bone. You cannot pick up if you don't know the bone disorders. So you need to know about what type of cystic lesion they are talking about, what type of hormone, which endocrine gland, which cell in the endocrine gland is responsible for the formation of such body disorder. Okay, so first of all, I will go through this image. It is not so clear, but what they are talking about in this. So they said that these are the small cell. Yes, they are the small cells with pale cytoplasm, little bit pale, or with a prominent nuclei. So it's a small round cell with a prominent nuclei. Okay, it's clear up till now. Now we will go for the colored histological image. If you see in this image, we can see that there are multiple white big cells here. So whenever you see parenchymal cell and adipocytes, and in case of endocrine, then you need to think that it is a parathyroid gland. So what are the cells present in parathyroid gland? There are mainly two cells. One is oxyphil cell and other is chief cell. Okay, the function of these two cells are different. The usual main cell that perform function is the chief cell. As the name saying that it's a chief cell. So it is responsible for the production of PTH. So the disorder they're asking in this image is something related to the PTH. It may be hyperparathyroidism or it may be hypoparathyroidism. Okay. So now I will show you what type of cell and how you can distinguish. Okay. Can you see some cells here? Maybe I need to clear it first. Okay. Now see, here's a group of cells. While other cells, they are scattered equally all around, everywhere. Here again a group of cells. So there are two cells that present in the group. Number first is the adipocytes and number second is the oxyphil cells. The oxyphil cells, they're quite a little bit larger than that of chief cells. They're not so regular in their structure. The nucleus is not so prominent. Cytoplasm is larger and it's pink or more eosinophilic than that of the chief cells. If you talk about the chief cell, they are small. They have pale cytoplasm a little bit and very dark or a dark nucleus. So you can see that all the dark nuclei here, you can see. So all these are what? Chief cell. They are abundant, larger in number. While the oxyphil cells, they are smaller in number. They present in a bunch of cells. They have more pink cytoplasm than they have the chief cells. Nuclei is not so prominent. Now, I hope you understood. Now, let's discuss the pathology here. Okay. Now see here. There is a condition or a bony disorder that is called as Osteitis Fibrosa Cystica. It is a disorder involving the bone which is resulted from the excessive production of the parathyroid hormone due to the parathyroid gland hyperactivity. It is also called as bone tumor. It is because of increased osteoclastic activity such as hyperparathyroidism. It is not a neoplasm. It is a simple bony mass or a cyst. Okay. Now, let me make you understand. Whenever the PTH level increases, parathyroid hormone, it may be primary, it may be secondary, okay? Usually primary. It may be in case of chronic kidney disease. What happened? The PTH level increases, it activates the osteoclastic activity much. Usually or mainly on the epiphyseal region. Okay, so there is a lysis of the bone and there is an inflammation, there will be hemorrhage and there will be formation of cyst with fibrosis, with hemorrhage. So this is what called as Osteitis fibrosa cystica. Now we understood that this is related to PTH, hyperparathyroidism, and which cells are responsible? The chief cells. They are mainly responsible for the production of PTH. Now I hope you understood that which type of cell is responsible. Okay, so now the our activity of the small pale cells around nuclei shown in the image leads to fibrous tissue with hemorrhagic foci and cyst formation. It is nothing but it is a Osteitis fibrosa cystica. It is nothing. It is you not need to be confused that they are asking about fibrosis or something blah 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 like that. Okay, so it is nothing. It is Osteitis fibrosa cystica. So it is not because of adipocytes. It is not because of parathyroid oxyphil cells. It is not because of thyroid C cells that is responsible for calcitonin. It is not because of thyroid follicle cell. It is because of parathyroid chief cells. Okay. So thank you so much